2.
Hello, everybody, and welcome to a very special Nursing Week event, RNAO's annual Take Your MPP to Work Day. My name is Sarah Downey, and I am the President and CEO of the Michael Garron Hospital in Toronto. Every year, the RNAO hosts this innovative event to give our government leaders an inside look at the vital work of nurses at all levels and in every corner of our healthcare system. This year, in the midst of a global pandemic, and ironically, in the Year of the Nurse, we've organized a virtual event to be sure to recognize the important contributions and values of nurses in our entire system. Today, I have two very special guests, the Honorable Christine Elliott, who is the Ontario Deputy Premier and Minister of Health, and Doris Greenspun, who is the CEO of the Registered Nurses Association of Ontario. We know that nursing looks a lot different this year. And in order to give you a behind the scenes look at what it's been like to care for our patients and community during COVID-19, we've asked a few of our own Michael Garron Hospital nurses to share their experiences. Irene Andrus, our Chief Nurse Executive at Michael Garron, will host a panel discussion shortly on this in this session. I want to take this opportunity to personally thank all our incredible nurses at Michael Garron Hospital and across the healthcare system for the exceptional work they do every single day. I also want to extend my sincere thanks and deep appreciation for those nurses who are the backbone of our COVID-19 response. They have stepped up to work across our system, in long-term care homes, in our COVID assessment center, at our screening doors, in our COVID positive units, in our ICU, and in addition to doing all the work of our hospital during these challenging times. Your tireless work has saved lives and reduced suffering in this incredibly challenging pandemic. And we've benefited from the strong community partnerships we have with other nurses across the system to ensure a well-coordinated and integrated response to this pandemic. So my thanks to the RNAO for hosting Take Your MPP to Work Day and providing us at Michael Garron the opportunity to share the work of our incredible nurses. Now let me hand it over to the Honorable Minister Elliott, who's with us today and who will thank nurses in the system. Minister Elliott.
Well, thank you very much, Sarah, and hello, everyone. It really is a pleasure to join you for the Take Your MPP to Work Day organized by RNAO, and I'd especially like to thank Doris Greenspun for her incredible work on this. It's something that I enjoy every year to hear about the extraordinary work that's being done by Ontario's nurses. So it's especially so this year with the challenges that COVID-19 has faced for all of us. And I want to thank you, all of you, and I look forward to hearing about your experiences in more detail. But I want to thank you for your extraordinary hard work, the dedication, and the compassion that you bring to each of the patients or residents, for those of you who have also stepped up to help out in our long-term care homes, for all of the work that you're doing. You truly are saving lives, and you're helping so many people return to health. This is a very, very difficult time, I know, for all of you, that you want to keep your patients well, you want to stay well yourselves, of course, and you want to keep your families well. So I really cannot thank you enough. You are the true heroes in all of this. You are on the front lines each and every day. You are selfless, you are courageous, you are professional. As the premiers would say, you're all champions, but you really are. You're doing wonderful, wonderful work. And I just want to give you my heartfelt thanks for everything that you do.
Thank you, Minister Elliott. Now, the person who also requires no introduction is Doris Greenspun, the CEO of the RNAO, who, in addition to being an incredible advocate for this really important profession, her other claim to fame is being a resident of the catchment area of Michael Garron Hospital and a champion pot banger, I might add, every night. So without further ado, Dr. Greenspun.
Thank you so very much, Sarah. And it's not difficult to be a champion of Michael Garron Hospital with your leadership, Sarah, that has been absolutely outstanding, and with Irene and all my colleagues. I do want to further that comment to the entire East Toronto OHT. Minister Elliott, if it's one thing that you will learn tomorrow when we release at 10 a.m. the ECHO report, is that not only the OHTs were put to test, but the results are we need to fasten the speed of the reform. Now we will give you some ideas, of course, of areas that need to sharpen more as we move with the reform, but we absolutely need to fasten its speed. I have been privileged to attend several of the meetings of the leaders of this specific OHT, and also of the front lines that discuss with Jeff Powie every single week or twice a week, what's coming up and what are the challenges, etc. And I have been so very impressed with the leadership across the board of all the sectors in this OHT, and also be made very keenly aware of the areas where additional supports from government are needed. So more on that tomorrow at 10 a.m. as we release the ECHO report. Today is the beginning of Nursing Week, and I want to issue a inspiring thank you to my colleagues in the front lines, the RNs, the RPNs, the nurse practitioners, and by extension, all the health professionals that have worked tirelessly, day in and day out, those that were working with patients that are positive COVID, and those that were, you know, holding the fort for the rest of patients. And both in Michael Garron hospitals, and as I said, also in all the community sectors, South Riverdale, and so many other sectors that are working, BHA, that are working so beautifully together to deliver the care that people need. With that, thank you to my colleagues. There is a full week of events. Visit our website at www.rnao.ca, the Nursing Week portal, and you will be able to participate in many events, including listening this evening to your own Chief Nurse Officer, Irene, which will do a fantastic presentation this evening. With that, I would like to pass, if you don't mind, Sarah, for a second, to my amazing president, Dr. Angela Cooper-Brathwaite, who will bring her own remarks on behalf of RNAO to all our colleagues in the front lines and in the sidelines and in the boardroom lines, all of you. Angela.
Thank you, Doris.
The podium is yours, Angela, for a second.
Okay. Good morning, everyone. And again, I just want to welcome you to Nursing Week 2020, the Year of the Nurse. And I want to thank all the nurses across the province in every sector, whether it's public health, hospital sector, whether it's community care, whether it's long-term care, whether in rehabilitative services, and all the health care professionals that you work with throughout the years to provide health care services to the patients and their families in Ontario. A special thanks for all those other people who collaborate with you, our police. You know, we also have, because they come to emergency as well to bring patients, or sometimes also to interact, or also to deal with some issues you might have in the ER. I know that from personal experience. I also want to thank our paramedics, who you work very closely with, the physicians, and all the allied health care professionals who have contributed the knowledge, skills, and ability to work with you during this difficult time. Yes, the time is difficult, but when difficult times come, they put us not only on the spotlight, but it gives us opportunities to innovate and to create new ways. For example, what we're doing here, but virally, this is part of Doris's innovation, working with her staff to do this. So I know you are able to do it. I thank you for your courage, your selfless practice, your giving of yourselves daily, and sometimes even to missing out on family times, I want to thank you for all that you have done, not only today, for the rest of the year and throughout the years of practice, because you are nurses. You care. You enter this profession because you care for people. You love people and you dedicated your lives to serving them. Thank you so much. Have a wonderful nursing week, and I wait to see you face to face. God bless.
Thank you very much to Doris and to Angela. Now, without further ado, I'm going to hand it over to Michael Garron Hospital's top nurse, the one that sits in the office down the hall from me and at our boardroom table, Irene Andrus. Over to you, Irene.
Thank you, Sarah. As we hear communities banging pots and pans and blowing horns at 7:30 p.m. each evening, for all the essential workers of this pandemic, I want to explicitly thank and call out the contribution of the nurses who come to work 24 hours a day, 7 days a week, 365 days of the year. Nurses who are responsible for being the eyes and the ears of the system, assessing, monitoring, detecting, treating, and evaluating people for changes in their health status or levels of illness, and for promoting health and educating people through the many transitions in life, from birth through death, good times and in bad. And for our fantastic nurse leaders who have spent the good part of the last 8 weeks constantly changing processes, policies, procedures to support the healthcare givers and patients that we are privileged to serve. It's my pleasure to introduce 3 of our Michael Garron Hospital nurses who have shown exemplary leadership in their practice through COVID-19. I'll take a few minutes to introduce you to them before we dive into some questions. First, we have Josie Barbieri Tacoma. Josie is an RN and the manager of the Complex Continuing Care Unit at Michael Garron Hospital. During COVID-19, Josie has demonstrated tremendous nursing leadership in the response to the long-term care crisis in Ontario. Josie is currently on the front lines of care at a long-term care home in East Toronto. Next, I would like to introduce Heidi Jensen. Heidi is a registered nurse in one of Michael Garron Hospital's intensive care unit. Heidi, who was on sabbatical at the time that the pandemic began, returned to the hospital early to step in and support her colleagues. Heidi has been involved in supporting the retraining of nurses that we have redeployed from different areas of the hospital. For example, from cardiology and surgery to increase our staffing in the intensive care unit during our COVID-19 response. And third, I'd like to introduce Laura Istanbulian. Laura is a nurse practitioner in the Michael Garron Hospital's medicine program with a focus of caring for patients in acute respiratory needs, including our provincial prolonged ventilation weaning center for excellence. This is a specialized program for adult ICU patients who have been stabilized from their acute illness but remain on mechanical ventilation for more than 14 days and wish to try to breathe on their own. Laura is a nursing PhD student and is currently conducting research on how to support critically ill patients in the ICU with their communication and designing interventions for clinicians to help facilitate improved communication. I can't think of a more important area to study right now. So let's dive into some questions, and we'll start with Josie. Josie, can you tell us about your experience supporting a long-term care home in East Toronto? What is your role and what has been your approach to leadership there?
Okay. Thank you, Irene. And thank you for giving me this opportunity. And I do have to say that I am very, very proud to be a nurse and in particular be part of this great organization at Michael Garron Hospital. So as the clinical nurse manager, say that my expertise does lie in working with the elderly, and also more specifically specialized in end-of-life care, palliative care. And the way I was asked to be part of supporting a home in Scarborough that required support with the COVID-19 that had begun to really ravage the home. So it was an outbreak. And our physician, Dr. Powis and Dr. Rosenberg, were quite overcome themselves and overwhelmed with the situation that had arisen in this particular home. And they reached out to me in recognizing the strength in nurse collaboration with leadership teams and how we work together here within our own organization. They asked me if I would be willing to go in there and support the nursing leadership in this home. So, of course, I would never decline. I felt that we were so incredibly well prepared for this pandemic, and we were waiting for it to arrive at our doorstep in a greater manner than it actually happened. So when it arrived in the long-term care homes, I know we were all shocked at how extreme it was. So I agreed to go in. I went in with the team. I felt that there needed to be nursing expertise in a fulsome manner. I gave a lot of thought to the approach because I think it's so important to demonstrate to the nurses in the home, to the management, and to the executive that we have to honor what they're going through. We have to respect them. We have to appreciate that they are doing their very best with what they have. Unfortunately, what they have is very limited, especially in a time of pandemic and a time that they just could never have perceived would have reached them in the manner that it did. So I did spend time to reach out to executive directors, speak to the directors of care on each unit, really listen to them, approach them with compassion, because I think as nurse colleagues, they need to know that even though I'm coming from a hospital where there is this perception that maybe it's another level of expertise, that maybe we're different than them as nurses, we're not. We're nursing colleagues. They are doing the very best with what they know. And I do feel that we had something to offer. So very non-judgmental approach, no criticism towards them, thanking them for what they're doing, and expressing that we wanted to create a partnership. So what this led to is I brought in our clinical resource lead. So she's an RN nurse educator, our palliative nurse specialist. Michael Guerin also brought in RNs from ER and our nursing led outreach team. So we really came together to try and support them. One of the things we did with each floor, and we worked directly with the directors of care, is we did teaching around the PPE, which was so imperative. The other key thing that mattered the most to them was supporting them with bringing in more staff to care for the residents, not only those that were sadly dying with COVID-19, but also the ones who were well but were being isolated in the rooms also needed care, and we didn't want those to be neglected in any way. The nursing process was something we really focused on with the nurses and the PSWs, rounding so that we could manage symptoms early, sharing our order sets around looking after the residents that had distressing symptoms. As you've heard with COVID, respiratory distress, unfortunately, is one of the symptoms at end of life. So doing point of care teaching, because they were having to provide opioids to manage distressed breathing. So teaching them how to use subcutaneous sets to deliver the medication as comfortably as possible. We also reviewed handover reports, created a sort of systemic approach, tried to simplify it for them because time is of the essence for these frontline care providers who were also working short-staffed. Also acknowledging them, how they were working so desperately in the moment. And there were many, many deaths, unfortunately, that they were experiencing. So it was incredibly overwhelming for them. And also bringing in our wellness specialists to give them some very brief pointers around self-care. The other really essential piece that sort of hit me and all of us as soon as we walked into the home is the effect of trauma to the front care workers. And I think it's so important for us as nurses to be able to talk about this in a very honest and forward manner. And we have to really hold each other up and hold each other in our hands when we're experiencing trauma, and yet working moment by moment to care for these residents. And I was asked by Irene, how did I know that the staff in the home were experiencing trauma? And two things. One, when I asked them what did they need from us, they were mute. They couldn't articulate what they wanted. They were so overwhelmed, they just wanted to do the doing that they had to get done to care for these residents. And the other thing is they said they felt numb. They just wanted us to help them do the work. So that really struck me. And I felt that we also needed to provide them some wellness. So our hospital did step up in providing them some wellness. And we talk a lot about resiliency in healthcare. I really feel that staff in nursing homes that are living through this pandemic are going to feel the traumatic effects of this months from now, even years from now. So we have a duty to acknowledge that and support them with that. Thank you.
Thank you so much, Josie. Laura, you're up next. Can you tell us about your work in the Provincial Weaning Center and how this has shifted, specifically during COVID-19, particularly the role that you've played as a liaison with family members?
Sure. If I could just first say it's a wonderful honor to be on this panel with you guys, with Doris, with Minister Elliott, Dr. Cooper, and of course my wonderful colleagues. Josie, I always learn like a million things from you every time I hear you talk. So thank you. And Irene and Sarah, thank you. It's wonderful to see you guys this morning. So to answer your question, I guess the Weaning Center, I know everything about it because I live it and breathe it every day. But what it is, it's a program where we, since SARS, I would say, have extracted patients from ICUs in our catchment area, actually beyond, and our own hospital, and we admit them to our center with the hopes to wean them from mechanical ventilation. And so the type of patient who comes to us is typically one that's medically stable, with the exception of requiring ventilation. And what we love to do is demedicalize them and bring a little bit more of the human person back from the ICU experience. I used to work in the ICU and I loved it there, but I think people love being out of ICU more than they love being in there. So, so what we've been doing since COVID started, and well before that, is we have been really trying to increase the capacity of our ICU and our surrounding ICUs. When we can't bring a patient into our center, we've been desperately trying to use OTN to consult with their teams, their interdisciplinary teams, their physicians, their nurses, their clinical nurse specialists, their RTs, PTs. So wonderfully interdisciplinary program to help these patients, these people, be liberated from the ventilator so that they can eventually go home. So since then, we've admitted quite a number of people. I think we're taking somebody tomorrow. And one of the roles that kind of has emerged for me as a nurse practitioner is one where I'm supporting family members. So communication with patients' family members has always been a huge part of my own personal passion for nursing, but now even more so, I think, because we have a very strict no visitor policy out of necessity. What I've done is with the co-leadership of my physician team and my great nursing staff and interdisciplinary team partners here on the unit, we do daily calls to family members in a proactive way. And what that's been shown to do is sort of ease some of the transition-related anxiety that patients' family members experience. It keeps them involved, and it takes some of the mystery out of what's going on here in the hospital. So it means a lot to us to support them. It supports the family members and the patients, and it supports us because, Josie, you're right, there's a lot of trauma in healthcare, especially now, and it feels really, it feels heavy to separate people from their family members. And so this feels good and it feels right. And it resonates with me when I was, my mom was in the hospital a few years ago. I remember it was a new experience for me to be on this side. And I was working here and my kid's at home and I don't drive very well. And she was in Mississauga in the hospital and I'm the only family member she trusts, well, trusted. She's passed since. But I remember I was desperate. I was for any update because my family, they relied on me to interpret what was going on. And she went from relatively well at home to delirious in the hospital, and then eventually stopped eating, stopped drinking, became septic and died. And we palliated her, thankfully, before she died. But one day a doc called me out of the blue, my cell phone, and I nearly wept because he proactively gave me a call. And I was so astounded that he took time out of his day to let me know what was going on with my mom. I told him later that, you know, his call meant so much more than just the information he was conveying. So that's something that we believe in very strongly here on our unit in our hospital. That kind of answer the question.
Thank you, Laura.
You're welcome.
Heidi, so you're on the
I know they're
sharp
big
edge.
questions.
You're on the sharp edge of this pandemic, Heidi. Can you paint a picture of what it's like to work as a nurse in the intensive care unit during COVID-19? And specifically, how does it look different during a pandemic?
Well, how many hours have you got?
Not
Everything's
many.
different. Everything is different.
Yeah.
Oh. I mean, working in the ICU is a stressful job anyway, but now everything's changed. The staffing mix has changed. We've brought in so many people from so many departments across the hospital, particularly cardiology and the surgery programs that have ramped down. They all have incredible skills and incredible nursing judgment, and they aren't ICU nurses. They have a lot of other skills. We're engaged in this massive uptraining, upskilling of turning smart, skilled nurses from across the hospital into almost fully trained ICU nurses. I am so excited to see what this investment in nurses is going to look like in 6 months. We've had a hard time keeping ICU staff, and we've had a hard time having enough ICU staff to fill the nursing positions and to make sure that everybody gets the care. We make it happen, but now we're going to have this great big pool, and it's really exciting to see that. It's also incredibly uncomfortable. Everybody's at the edge of their comfort zone. I'm not used to delegating and working in a team that looks like this and that feels like this. And they're not used to seeing ventilators and all these drips and all of that overlaid with the fear of catching COVID or bringing it home to our families or ending up sick ourselves. So that is hard. Being at the edge of our comfort zone, all of us. Last week I had a cardiology patient and I was so glad that there were cardiology nurses that I could go to in my unit as resources. So, I mean, I'm upskilling too. We're all learning so many new things. It is weird and uncomfortable. You use the word heavy, Laura. It's heavy having no families. It's so bizarre. And Ramadan is happening right now, so families want to pray with their loved ones. Coming together as a family is what we do during big family holidays like this. And so we're adapting. We're coming together on Zoom instead, the same way we're coming together today. We have an iPad in the unit, and in the evening it's busy because prayers and family gatherings aren't a thing that happens in 5 minutes, or 20 minutes, like a medical update. You pull it together the way you can, and everybody's in isolation. We speak with our eyebrows. We wink at each other. We make a lot of faces at each other because you can't just smile when you pass somebody. Everything's hotter. Everything's slower when you want to go into a patient room. But the patient care is happening. They are getting the care that they need, and we're doing the best we can.
Thank you so much. Heidi, I think you've pointed out as well some of the small gifts that we're also receiving during this pandemic. And we need to make sure that we continue to optimize on that innovation. So thank you for bringing those threads through. Josie, a follow-up question for you. Based on your experience then working in long-term care during COVID-19, do you think that hospitals and the healthcare system should think differently about how to work with this sector?
I love that question. And my immediate response is absolutely. That's big, bold, absolutely underlined. And this needs to become
So Josie, come tomorrow to the release of ECHO. You will hear all about that.
Wonderful. I'm so excited. The new reality. Our communities and society has to participate in creating a safer and more equitable care system to the elderly at all times. There would be nothing more startling for you and me to find ourselves in 10 to 20 years from now as older adults or seniors, if we're not already there, in another pandemic with similar outcomes. So this will be a time for great reflection, discernment, and spur on new research that will be practical and innovative. There are many broken issues in the long-term care homes in Ontario. We already know that. And I know that for the past 5 years or so, there have been initiatives to try and put these in place to make these improvements in the system. But we all recognize now with this pandemic that a lot more needs to be done. Many hospitals, such as the one I'm in, have the richness of strong academic underpinnings with research commitments, and we draw on dedicated, high-achieving employees. This is not generally the case for long-term care homes. In this system, we have to value the work of nurses in the long-term care homes as much as we value nurses in hospitals and primary health care services. The nurses and the PSWs in long-term care homes receive low pay. That's been put out there. The public now knows that if they didn't before, and also low staffing ratio. And this also impacts on the self-worth of the staff, along with affecting societal expectations. Until this pandemic, few people in our communities were really fully aware of the broken pieces. The silver lining to this pandemic is the truth of it that we're all witnessing, all of us. I believe the nursing profession can be key in elevating the long-term care services post-pandemic. We all know that nursing knowledge and expert practices are significant to leading changes to improve care services in the continuum of care. Finding innovative ways of bridging hospital institutions with our community services, including the long-term care homes, can lend to safer and improved care to the elderly in our society. I believe that as nurses we can and we will continue to show leadership and play an immense part in striving for these improvements. And I just want to add personally that I have a mother who went to long-term care home a year ago. Fortunately, she's in a home right now that doesn't have an outbreak, but I'm sitting on both sides where I can't go in to visit my mother. And unfortunately, 2 weeks ago, she had a very serious fall with a huge laceration to her head. And I had to make a decision of whether they should bring her to ER or should she be cared for in the home. If I didn't have the nursing background and skill that I have, my mother may not have gotten the extent of care that she's presently receiving in the home. Because I can advocate not just as a daughter, but as a skilled nurse, I knew how to make things happen. But I'm not a reflection of most people in our community. So I'm really experiencing both sides of it, which is a real eye-opener to me.
Thank you, Josie. Laura, back to you. I know research is a big passion of yours, and you're currently a nursing PhD student. Can you tell me about what inspired this pursuit and share what type of research you're working on right now?
I'm going to try and answer that like in a really, because I think traditionally that answer is really long, but I'm going to do my best. So when I took the role as a nurse practitioner at the Provincial Center for Excellence in Weaning, or the Weaning Center as we call it, I think at the interview, Irene, I remember telling you right then and there that I was going to do this. I still got the job. That's great. So I have been eager to do this for my whole life. I believe strongly that nursing is rooted in scholarship. I believe that nurses care, but we also care to know how and why. And we also are wonderful, wonderful teachers. We teach each other everything that we know, and we learn in so doing. So I know that I've been very, very fortunate to be a PhD student while I'm working here at Michael Garron. I'm in my second year at the Lawrence S. Bloomberg Faculty of Nursing. My supervisor is, I basically like hit the jackpot with Dr. Craig Dale. He's an amazing ICU researcher. And he really believes in keeping nursing work central to the research that he does in the ICU, and really truly in understanding both the nursing practice side, but the patient experience side. So bringing that sense of humanity front and center. So research does mean a lot to me, but I'm a student of it, and I have so much to learn. My research will be around communication. It will be around patient communication this time. Heidi, you hit it. It's so hard with our masks on to communicate with patients and understand what they're saying, let alone have them understand what we're saying. Even pre-COVID, it's probably one of the most frustrating experiences that ICU patients have shared with us, is that they're not understood. And that can lead to numerous physical and psychological problems that extend within the hospitalization and beyond. So it matters a lot to me. One thing I've learned in a PhD program is that you take your idea, which is this big, and you have to narrow it to something that's that small so that you can learn the craft. So I'm doing that right now, and I'm hoping that I can gather like-minded and unlike-minded people here of all disciplines at some point, and we can continue to do the amazing research that this hospital has done and has supported me through. So
that
wasn't bad. That was like 2 minutes.
Laura, thank you very much. Thanks for everything you do every day. And Heidi, we're going to close with you. So you get the last word here. So the question to you, Heidi, is how do you stay mentally and psychologically resilient during this very difficult time?
Change is stressful, and every day is full of change. But folks pull together. I take strength from my colleagues. My most rewarding days are always some of the hardest and busiest. But those are the days when everybody just says yes. When you say, can you grab me this? I need help with that. And everybody's running. Everybody just says yes. And there's so many people on the team. The respiratory therapists are in every single COVID room, as far as I can tell, whether you're on oxygen of one form or another, they're definitely in every single vented patient's room every single day. They say yes. Whenever I say I'm having trouble, one of them comes, and there's not that many of them. There's usually only about 3 in the hospital. The social worker has been instrumental in pulling the communication piece together from day to day, to making sure that the healthcare team knows who to call and that the families know who to call on the healthcare team. that eases a lot of the stress and helps me with my resilience because I don't have to worry so much. There's somebody taking care of it. So leaning on the team around me, I know that every surface is getting cleaned. It usually gets cleaned 100 times a day. Now it's getting cleaned 200 times a day. That also helps with stress management and resilience, trusting the people around me. Uncertainty can be a problem. It's hard to know who to trust when the CDC says one thing and the World Health Organization says you should do that. But I trust our infection control and prevention team at Michael Garron, Dr. Jeff Powis and Dr. Janine McCready are experts. They read this research, they live and breathe this research. They interpret it and they bounce it off of each other. It's not just one person stuck in an echo chamber. And I trust their judgment to apply it to our hospital. They have a strong incentive to keep me safe. So trusting them helps with resilience. I could not get through this without my partner. He set up my AV today. He helps me every day. Having a strong support network at home, whether it's I'm too tired to walk the dog or I'm too tired to decide what's for dinner. Having a strong support network between my partner and my therapist is critical. The only other thing that I can think of that's really applicable to, I think, a lot of people is a COVID break. Oh my goodness, I can't stay immersed in the news for this long. Turn off my phone, don't even put on the radio, even on the music channels. There's still a news break every hour. No. Disney Plus or like escapist TV or dumb phone games. I don't know, I hear everybody else is doing it with Animal Crossing. I don't have Animal Crossing, but COVID breaks, at least 6 or 8 hours, especially on my first day off, are critical. So far, I think I'm doing okay, but I have hope that I'm going to do better, and we're all going to do better as more information comes in. Uncertainty creates stress, but there's so much information being gathered and research being done on this virus as we go that uncertainty is getting less and less every day. And I have hope that with more information comes more certainty and less stress. I have hope.
Thank you so much. I'm always in awe of the wisdom that nurses will share with each other. And so thank you for being with us today and for sharing your personal experience.
Irene?
Yes, Doris.
It would be awesome, and I am sorry to put you on the spot, Minister, but you always fly when you are put on the spot, so I don't mind. For you to share, you and I have had for a long time a close relationship, and I have watched you and spoken with you during all this period, and I watch you on the television every day. How do you keep your resilience, Minister? Because kudos to you.
Well, thank you very much, Doris. For me, I like to have COVID breaks every once in a while too, which I spend with my my sons. I have a great support network as well, and that's really, really important. But I also would just like to take a moment to thank you, Josie and Laura and Heidi, for sharing with us details about your experience. And I've been struck by several things. One is your incredible professionalism that you carry on despite any roadblocks that are put in your way. And you do it with such a great sense of humanity. And that came through in all of the remarks all three of you made when you were speaking, Josie, about the trauma on the frontline workers and wanting to do something to help them with wellness. That is a very, very important consideration and something that we are going to need to deal with as we hopefully exit the peak period very soon and start returning to, I guess, the new normal in our lives, but that's really important. And with you, Laura, speaking about the communication that is so important to you in your professional work, but also in your personal life when you had that phone call from the physician, that how much it made a difference to you when you were going through your own situation. And then Heidi, hearing from you about the work that you're doing, dealing with new people, but how everybody is coming forward and how you're trying to have that sense of close communication with your coworkers, helping them to become intensive care nurses and to do the kind of work that you do on a daily basis, but also bringing communications in so that because there are no family members there, helping people to have some kind of access to the outside world and to their families. So I was really struck by that, both your humanity and your professionalism. And I look forward to hearing more from all of you about the changes that you think that we need to make as we return to more normal, I guess, nursing practices. But I certainly share your concern, Josie, with respect to long-term care. We will be having an intensive look at intensive care, at long-term care, because this has really exposed some weaknesses and some issues that we need to deal with, and can't wait for another pandemic. We need to deal with this way to make sure that our very, very vulnerable patients are cared for in the best way possible moving forward. But I think we need to look at other aspects of our healthcare system as well, that we need to look at this as, it's been very challenging, no question about it, but we have to look at it as an opportunity to consult with each other and to do better.
Yes.
I definitely want to hear from all of you and your ideas moving forward. So thank you so much for sharing your experiences with all of us today.
You're welcome.
Thank you. Doris, do you
Echo
have a
from
few?
RNAO to your tremendous expertise. Tremendous expertise, all of you. I just, I marvel every day, not only during ECHO, and not only during COVID, and not only during Nursing Week, about the tremendous knowledge and compassion that my colleagues have in every single role and in every single area of practice, as well as the courage to really articulate that publicly and firmly with anybody that comes to be. The only wish that I would have, in addition to what the minister said, that we all will be engaging with in what reforms need to happen, is that nurses could speak, disarticulate, and this comment goes for you, Sarah, and for Irene, but mainly for Sarah. Disarticulate and openly with the media. Every time that we need to have a frontliner speak to the media, that person needs to go through 20,000 hula hoops. It's not only in your organization, it's in all the organizations, Sarah. And I think if the public could hear more from practitioners about all of it, about the tremendous privilege that it is to be a clinician in the front line of care every day, and especially during crisis times like now. If they could hear the expertise that they bring, if they could hear the compassion, the common sense, the capacity to partner with others, the capacity to step up to the plate in ways that every day, you know, is happening during COVID more. I think that we wouldn't need a nursing week. We wouldn't need a nursing day even. The public would, they are celebrating as it is now nursing, but they would just understand so much more the potential solutions that nursing brings to the table. And this is not only in hospital care. And Minister Elliott, tomorrow you will meet Lord Nigel Crisp, who will speak about that. And that's why he, that is not a nurse, created this Nursing Now 3-year event that I think he will echo my sentiments, that organizations, because doctors don't need to ask permission from organizations, but nurses do. That we need to free up nurses to speak up and out to the media, because it will do a lot of good for the health system and for the profession. So maybe that's a strong message for Nursing Week, to ask my colleagues, presidents and CEOs of, all organizations, hospitals, public health units, home care, et cetera, to free up nurses to speak out to the media. I think maybe that's a call that RNO will start to take forward, because we shortchange the public by not really very quickly allowing nurses to speak freely like any other professional can.
Great. And thank you, Doris, and thank you, Minister Elliott, for taking the time out of your busy schedules, given everything that's going on, to spend an hour with the nurses at Michael Garron Hospital and the panel who's just been able to share their stories and experiences and expertise with you. We greatly appreciate the time. To our amazing panel members, Doris, there's no problem at all finding a great story to tell, and it took a little coercion sometimes to get nurses to stand up and do this, but the three today, I think, are media ready, I would say. They're incredibly articulate and compassionate and real experts, and I think can provide us with a real viewpoint on the complexities of the nursing profession in general and what COVID-19 has done, and forcing us into situations that are really quite challenging. And as always, nurses shine and help us all be better people and a better health system. And I'm so incredibly proud to work in an organization led by Irene, and with outstanding people like Heidi, Laura, and Josie, who are doing the heavy lifting of our work. And so to everybody, in the Year of the Nurse, as designated by the World Health Organization, happy Nursing Week. And I look forward to many more celebrations and a few surprises that are coming up this week to help be sure that our whole organization knows how much we appreciate all our nurses. So thank you.
Happy Nursing Week, Michael Garron Hospital staff.
Thank you.
Thank you.
Thank you.
Thank you.